this is Julie with the Palmer Public Library. Welcome to Health Beat. Today's video will describe different types of headaches, specifically what are called primary headaches. Headaches associated with underlying diseases or conditions are called secondary headaches. We will keep this discussion exclusively to primary headaches only. A primary headache is when the headache itself is the main problem. It is not a symptom of an underlying disease or condition. A primary headache is caused by overactivity of or problems with pain-sensitive structures in your head, such as nerves and muscles. Some of the most common types of primary headaches, according to Stanford Healthcare and the Mayo Clinic, are cluster headaches, tension headaches, hypnic headaches, and migraine headaches. The first is cluster headaches. Cluster headaches occur in cyclical patterns of cluster periods. They usually last between 20 minutes and 2 hours. This type of headache tends to occur several to many times a day for periods of days or weeks, then disappears for an amount of time, usually weeks to months or even years. You may tend to get them at the same time each year, such as in the spring or fall. Cluster headaches may go away completely, called remission, for months or years, according to the Mayo Clinic, but they can come back without warning. Experts don't know what causes cluster headaches, but a nerve in your face, the trigeminal nerve, is involved, creating intense pain around one of your eyes and possibly your forehead, cheek, jaw, and ear. There are a few things that set this type of headache apart. They include speed. Cluster headaches generally reach their full force quickly, within 5 to 10 minutes. Pain. It's almost always on one side of your head, and it stays on the same side during a cluster period. It's often described as a burning, piercing, throbbing, or constant pain. Along with pain around your eye, you may feel pain in your forehead, temple, nose, cheek, or upper gum. Short duration. Cluster headaches typically last between roughly 30 to 90 minutes and are usually predictable in that they occur at generally the same time each day. The frequency pattern is typically a daily headache for 2 weeks to 3 months. In between these periods, you may be pain-free for at least 2 weeks. Symptoms. The pain usually starts suddenly. You may notice discomfort or a mild burning feeling, a swollen or drooping eye redness or watering, runny or congested nose, red, warm face, sensitivity to light, or sweating. When you're in a cluster period, any of these triggers can bring on a headache: cigarette smoke, alcohol, or strong smells. The next type of headache is a tension headache. A tension headache is generally a diffuse, mild to moderate pain in your head that's often described as feeling like a tight band around your head, with pain in the back of your head, your temples, and forehead. These headaches can last for hours to days. This type of headache can affect both sides of your head equally. It can make the muscles in your neck, shoulder, and jaw feel tight and sore. Common causes of a tension headache include mild to moderate pain or pressure in the front, top, or sides of your head, a headache that starts later in the day, trouble sleeping, feeling very tired or irritable, trouble focusing, mild sensitivity to light or noise, and muscle aches. Tension headache triggers may include not enough rest, poor posture, emotional or mental stress, anxiety, hunger and skipping meals, low iron levels, alcohol, caffeine, jaw or dental problems, eye strain, dehydration, smoking, a cold, the flu, or a sinus infection. The third type of headache is a hypnic headache. This is a more rare form of headache occurring in people aged 40 to 80 that occurs exclusively at night. According to the Mayo Clinic, this type of headache usually awakens the person at the same time every night. This type of headache typically lasts between 15 and 60 minutes. The pain can range from mild to severe and is usually bilateral. And according to the American Migraine Foundation, some people experience migraine-like symptoms, including nausea. And the last type of headache is a migraine headache. The symptoms of a migraine headache, according to the Mayo Clinic, can progress through 4 stages: prodrome, aura, attack, and postdrome. In the prodrome stage, 1 or 2 days before a migraine, you may notice subtle changes that warn a migraine may be coming. These include mood changes, food cravings, neck stiffness, increased thirst and urination, or frequent yawning. The aura stage might occur before or during a migraine. Each symptom usually begins gradually and can last for 20 to 60 minutes. Examples of migraine aura can include visual phenomena, such as seeing various shapes, bright spots, or flashes of light, vision loss, pins and needles sensation in an arm or leg, weakness or numbness in the face or on one side of the body, difficulty speaking, hearing noises or music, and uncontrollable jerking or other movements. Next is the migraine attack stage. A migraine attack usually lasts from 4 to 72 hours if left untreated. Migraines might occur rarely or strike several times a month. During a migraine, you might have pain, usually on one side of your head, but often on both sides. Pain can be so severe it affects your daily activities. Pain that throbs or pulses, sensitivity to light, sound, and sometimes smell and touch, nausea and vomiting. And last is the postdrome stage. In this stage, after a migraine, you experience feeling drained, confused, elated, or tired. Some factors that may contribute to the onset of any of these described primary headaches may include medication, dehydration, or changing hormone levels. Other factors, known as triggers, tend to be environmental or linked to diet, such as pulsating or bright light, certain foods like caffeine, red wine, chocolates, or aged cheeses, stress or sleep, too much or too little. 2 tools that can help you deal with understanding your possible primary headache patterns and triggers are a headache trigger tracker and a headache diary. The headache trigger tracker can help you identify those things, foods, drinks, events, etc., that may cause or worsen your headaches. Once you are aware of any triggers for your headaches, you can discuss ways to manage them with your doctor. To make a quick tracker at home, take a sheet of paper and on the left, list those things that you think might trigger, either cause or worsen your headaches. On the right side of the paper, estimate how often that trigger will lead to a headache. For example, if red wine always gives you a headache, put 100%. If skipping a meal gives you a headache about half of the time, put 50%. The next tool is a headache diary. Writing a headache diary helps to monitor the frequency, duration, and severity of your headaches over time, identifies patterns that may help determine triggers and improve treatment. Track any medication you may use for your headaches and your response to it, and help you maintain records that you can look back on of what has worked and what has not worked. There are many useful headache diary apps that can help you track your daily triggers and your headache severity. Two examples are the Migraine Buddy and Headache Log apps. And you can also find a printable headache diary by going to the website for the National Headache Foundation. And here is a copy of that diary from the National Headache Foundation. I know that it's hard to see, but I'll tell you over the top. Some of the columns are date, time, start and finish, intensity, rate 1 to 10, most severe being 10, preceding symptoms, triggers, medication and dosage, and relief, complete, moderate, or none. And again, that was from the National Headache Foundation. I hope this video was useful in helping you become familiar with the types of primary headaches. Understanding some of your triggers for bringing on these headaches is beneficial, but discussing your headaches with your doctor is important and will help you best understand what types of headaches you may be suffering from and give you the best chance at finding effective and successful treatment options specifically for you. Thank you very much for watching Palmer Public Library's Health Beat.